It's another session sitting around the table with the SCM nurses. And today we're talking about summer self care tips. So, quick tips that you can share on the go as far as helping folks stay healthy in the summer. Summer brings unique challenges. What do you think, ladies? And
It sure does,
yeah,
especially with the older, people, because as they get older, I'm sure, and I know this happens with my father, he barely drinks because like, well, I'm not thirsty, but it's so
yeah.
important that they drink anyway. And I try to, tell him all the time, even if you're not thirsty, drink, because their sense of thirst decreases as they get older.
Well,
So,
that's true. Or they might have incontinence issues or urgency issues, whether it's a female, right? As we get older, I've had 3 kids. I'm not going to share TMI, I promise, but the uterus drops. A couple of things happen. The uterus drops, and especially as you head into menopause, some things change, and some women can experience stress incontinence or more frequent UTIs, kidney stones in particular, or for our guys out there, if we have prostate enlargement, and it's a hassle, right? If you have to go to the doctor's appointment or you're traveling and you're worried about having incontinence issues or it's hard to get a stream going, well, you're just not going to drink because then you don't have to deal with it, right?
right.
Happens really quick.
Yeah, I think to your point too, Nancy, I think that's always been my tip, not waiting to feel thirsty, because that's usually what most folks say. Um, and usually another thing is people say, well, I drink more water because my urine was, more concentrated, more yellow. And it's important to know that usually that's a late sign. If you're waiting to see how your urine
Yeah.
looks, typically that's a late sign. Usually we don't want your urine to be clear. And I know it can be kind of TMI and, weird to talk about urine and color and all that
But we all
stuff.
pee.
Correct. Yeah. But you don't want it to be clear either. You're probably overhydrating. There's other signs of
Yeah.
diabetes and things like that, that if it's too clear, it's not good. But clear yellow, usually, if it's a very dark yellow, that's usually not good. It can be dehydration and can lead to a lot of other things, especially during the summer in the sun. And young folks sometimes may think that they're not at risk, but we know there are a lot of cases during the summer of rhabdomyolysis, just being in the sun, not drinking enough water, and having these issues that could lead to kidney failure as well.
Yeah, or a lot of your sports. How many of us have heard of young kids, football players, out in the sun that end up in the emergency room or have a heart issue because they got dehydrated, or they're drinking energy drinks, right? That dehydrate them and they're not hydrating on top of that. So, great points. What do you think, Jasmine?
Yeah, no, by the time you feel dehydrated or thirsty, it's probably too late too. That's one of the other, they say it's too late. But one of my ladies I was just talking to yesterday, she actually started picking up gardening, and she's been adding basil and spearmint to her lemon water. And she goes, it's her go-to now, and she loves it. So that's really,
Oh,
she's doing great. Going up from like 60 to 90 ounces. So which was her goal. She's doing good. And then about urine, a lot of people definitely get scared to drink more because of the urinary urgency, like you guys are mentioning. So
yeah.
one of our people, he's a truck driver, and it's hard for him to stop in the middle of
Yeah.
his trips. So one thing that we were talking about was scheduling his stops. So trying to make sure, eyeing where he's at and making sure he can stop at least every 45 minutes to an hour, because it depends on where the stops are, but at least hourly. And so he can continue drinking and not being afraid of stopping to go to the bathroom, because, he does have that issue where if he waits too long, it's hard for him to go. And then it's painful if he waits too long. So that's scheduling those times to really be purposeful and stop to go to the bathroom I think is important for those type of people.
Scheduling those times to pee, but I think it's also important to schedule those times to drink the water, right? So you want to make sure you're on a fixed schedule. And I usually always tell, especially older folks, but even myself, if I'm going to drink water, I'm going to drink water more of the beginning of the half of the day. Because once it gets closer to 5, if I start drinking a lot of water, I'm also going to be peeing it up all night.
Yeah, amen to that. Front loading your fluids. I think that's a great way to start the day. I find when I start off every morning, I have a quart jar. If I start off every morning with a quart, I find I have more energy through the day too. So, and then if the day gets busy and gets away from me and I haven't stopped to drink, I'm already almost there, right? So, yeah, that's really important. When you think about things like, a lot of people don't know if people are prone to kidney stones. It's hard to make a rock if you're always moving water through, right? There's not time for those particles to come together and make a rock. So preventing kidney stones are also for our folks on ACE inhibitors, right? Like the prills, your lisinoprils, your folks with high blood pressure. I know, working in the ER for many years, summertime, you'd always see them come in, and because they got dehydrated construction workers, they have a hard go, don't they? And then they're in acute kidney failure because you cannot get dehydrated on some of those meds.
Yeah. I think a lot of folks also have the issue where a lot of my patients have had the issue of, I just forget and I'm busy.
Yeah.
And I call it, emotional support water bottle. Just carry one around. The cuter, the better, right? I feel like the cuter, the more likely you're going to use it.
Share your bottle because it's cute. There is something about, I have my green mix in
I like that.
right now. And so I think there's something to having a pretty bottle or like yay, yeah, right? It makes you want to drink because it's pretty. It feels good in your hand. It sounds kind of corny. I don't know if guys are wired like that, but like your patient with the, you say the basil and the spearmint. Oh, I love the smell of basil. Like, in my water,
That was
it feels
new to
like
me. I never heard of putting basil in your water, but yeah, it was nice.
Cucumbers, a handful. I call it pretty water. Now, I guess if for our male guys out there, we'll call it, what do you call it? Handsome water, right? Fun water. I don't know what you call it, but jazz it up. Because there is a point, right? Because some people, they just don't like the taste of water, and it's really hard for them to drink enough water. Then they opt for some of the flavorings, and that, add sugar or other things. It's so much better to throw in a handful of fruit. Or I like orange slices. Orange or lemon slices. It's so much better than the juice. It's just pretty. Doesn't it make you feel like you're drinking like something at a spa?
Something fancy.
Yeah.
And you know what? And I have my water bottles in front of me at my desk too. But sometimes I'm just going so hard, just working, just this and that. I don't even look at my water bottle. So what I had to start doing is I literally have a reminder on my phone that at least every 2 hours goes off. So I know I need to drink at least half of my water bottle. And I've got a 32 ounce. So yeah, that's just something that I've had to do for me. And I tell my members that too, like, it's not weird to have a reminder to drink water. It's something that, people can go hours, 6, 7, 8 hours without drinking anything. I remember working bedside and going, oh my goodness, so many hours without drinking water. And by the time that I get to my, computer, I'm like, I am parched. Like, I am so thirsty. Well, no wonder. So it, however it works for each individual, I think, that's what works for them. And I know for me, it's that reminder. I'm like, oh, there's my reminder. So.
Hey, that'll make you get up from your desk and stretch your legs too.
It sure does. Yeah.
It's weird too, because I feel like, to Nancy's point, when I was in the hospital, I think I was definitely drinking more water. Because you're up on your feet, so it's kind of easier to like go in and out of a bathroom. I don't know. I used to, or it's easier to go in and out of the kitchen. No, I don't know. For me, it was just easier. I think I just would, like I said, it would take me a minute, especially if you're near one. So it would be easier versus here. I'm like having to get up and I don't know. I feel like working from home has actually made it more difficult.
Well, and you know what? When I used to work at the hospital, like going to the bathroom was like a break for me. So it's
Yeah,
like I
right?
think I used to go to the bath at least go to the bathroom more than I do now, probably because I drank a little bit more too. But it's just yeah, it's however it works for people. Yeah. I mean, some people find it hard to drink a lot when they're at home and some find it hard when they're working. But we have to make it work. And something I tell my members is that if they find it hard to drink all the water they should be drinking during the day, I tell them in the morning, as soon as you wake up, have a water bottle at your bedside. And the first thing you do, just sit up, and just, relax a little bit and just drink that water bottle. You've already got 16 ounces, for the day of water in you. So, especially if they're trying to increase, their water, I just say, just drink half of it every day for a week. And the next week, drink the whole thing, in the morning for a week. And that's how you sort of increase your water intake.
I think that's a great idea.
Yeah, little by little. Because I mean, and that's another thing. Sometimes talking to patients, you don't want to say, well, if you're weighing 140 pounds, if we calculate your ounces, you should be drinking 70 ounces. That means nothing, right? You can tell someone to do something all you want, but setting realistic goals is important, just like Nancy says, little by little. So instead, if they're only drinking, let's say, out of the 70 ounces they should be drinking, they only drink 50. Set a realistic goal, or if it's lower, I should say maybe 30, start 10 ounces
Yeah,
more, where you're
yeah.
challenging them every week and even reminding them every week, hey, let's go up 10 more ounces, see how you do. And it also helps train their bodies, where they're not having to pee all the time. Because I think that's the biggest
Yeah,
thing I always get.
absolutely.
I don't want to have to be in the bathroom so much.
Yeah. It's hard, right? If you can't take a break or traveling, right? How many people travel during the summer? That makes it hard. And we have increased fluid requirements sometimes when we travel. If you're up higher in the ozone layer, so to speak, we know we have a greater hydration need, but that's hard because you're traveling and you can't always control if you can get up. So, yeah. That's fantastic. So everybody needs to drink, right? Or fluid restriction. That's another one. So for some of our folks who are on fluid restrictions, sometimes people are on a fluid restriction because of congestive heart failure or because they're on dialysis. So, what do you guys think? Nancy, as our dialysis expert, what do you think are some great tips that can help folks who are dealing with thirst and they can't drink too much because they're on a fluid restriction, the other end of the spectrum?
Yeah, there's definitely things that they can do instead of just drinking, straight water. They can freeze some grapes, put in the freezer, and as long as they're not a diabetic. But even diabetics, one, two, three
Even,
grapes,
yeah.
it's fine. And you could do that with really any fruit. I mean, you could freeze watermelon. I mean, that's loaded with water, sugar, of course, so no diabetics. But you could do it with orange slices too. So any fruit that has a lot of water content, that is good because it keeps their mouths busy, and it also hydrates them as well. Ice also helps, but that I don't
It's
know.
still water.
It's still
Yep.
water, yeah, and people usually overdo it because it's not, I don't
Yeah.
know. It's just not the same.
Yeah.
So yeah, so those are the things that I would recommend. And I know that there's more. I just can't think of them right now. Oh,
Well,
what do you?
or sodium. One of my first things with people when they're on a fluid restriction is to look at your sodium content, right? Because when you have something salty, the body's response is to thin it out a little bit. So it naturally, for two things happen. When we have something that's loaded with sodium, the body holds on to water, right? Because your body wants to keep everything at a certain amount of sodium. And so it'll hold on to water. And then it's also going to make you thirsty. So, especially for folks on dialysis, usually the first thing to help people with thirst is watch the sodium content.
Mhm.
That helps a lot. Yeah. Interesting factoid. I once had a patient many years ago who she had her bowels hadn't moved for so long. It had been weeks, and they were going to go in, and her bowels had completely shut down. They were going to go in, and they were talking about surgery. And I went in and I started talking to her about fluids and how she had to hydrate. I kid you not, she started drinking. I'm
Oh, I think she froze.
Oh, now her camera's off too.
Oh,
Oh, there you go.
yeah. Anyway, so the effects are profound. But what are some other good summer tips that you guys have for busy folks on the go during the summer?
I think with your dialysis patients, going back to that, I think lozenges and things like that can also be very good. Just stimulating the saliva, right, can help reduce that
Yeah.
feeling of thirst.
Or artificial saliva. I know it sounds pretty unappealing, but it's really helpful. Bless you.
Yep. Thank you.
Yeah.
Another thing, and I know we're talking about hydration too, but when it comes to like activity, trying to fit it in the morning before it gets too hot.
Ooh, nice
They
point.
I've been telling a lot of people, like just I know sometimes if you're not a morning person anymore, it could be hard, but it's good to just get it out of the way and it'll give you energy for the rest of the day and you won't be sweating as much if you fit it in early in the morning.
Yeah, absolutely. And speaking of that, being out in the hot summer sun, Stephanie heads our oncology management team. What do you think as far as tips for helping folks stay skin safe in the summer heat?
Yeah, I think for the most part, every other thing that we spoke of applies regarding hydration. But usually with sun, sunscreen, SPF, you want to make sure you're using, especially if you're on any treatments, even oral chemo, that some patients will be taking for years after their treatments and main goals and all of that. A lot of that can make your skin hypersensitive on steroids. Jasmine's mentioned it
Yeah.
on antibiotics, so not even related to cancer. A lot of these things can make you even more sensitive to the sun. Just wearing long sleeves. They have SPF long sleeve shirts, which are great. Hats,
Yeah, I love those.
glasses, reapplying sunscreen is really important. Even if it's cloudy, UV rates are usually very high, even on cloudy days.
Yeah.
And I discovered the other day, I forgot we were having a conversation and Hannah mentioned the SPF for the scalp, for the hair.
Oh,
And that's a good one.
yeah.
That's a good one. I didn't know that existed, but that's a
Yeah.
really good thing because a lot of people, especially with melanoma, will get it in the scalp.
Yeah. How many of you have had a skin check lately?
No, but I do want to get one.
I'm getting older. I went in for my skin check, and yeah, with blonde and very fair skin. You wouldn't, sunless tanner. I'm not ashamed to say I get my tan out of a bottle. Thank you very much. I'm very pale. But yeah, if you're looking for a tan, there is no tan that's safe for your skin. And you brought up, a lot of the folks with cancer therapy that are on immunosuppressant. Same thing with our folks who've had a kidney transplant. Oftentimes that we teach those folks to make sure that they're wearing a sunscreen because they are more at risk for skin cancers, and that would not be fun. I know another thing that a lot of times in the summertime we talk about people are busy on the go. I know some of us have kids in sports or day camps or activities, or we're traveling. As we wrap up here, what are some great tips that we can share for helping people eat healthy and nutritiously while they're really busy and on the go, traveling and whatnot?
I think just bringing food. I think sometimes, I know it sounds silly, but we always bring food for vacation, especially with a baby. Um, you might want to indulge while on vacation, and that's totally fine. You want to make sure that you're also enjoying yourself. But if you're able to, like, say, prepare a meal for breakfast and lunch and just eat out at dinner, that alone can be helpful. So sometimes even just bringing, if you're going to an Airbnb or, a hotel that has a kitchenette, bringing some berries, some bananas, some apples, very easy access foods. Sometimes just eggs too, where you can just boil them, as most places have at least a pot and stuff like that. Even coffee. If you go to Starbucks and get a coffee, you're easily consuming anywhere from like 300 to 700 calories, as opposed to just making
Yeah.
the pot in the hotel or in your home.
Absolutely. Those are fantastic tips. And it's interesting because sometimes, to your point, people went on vacation. We think we're going to live it up. Well, a vacation is also a great time to reset. A vacation is also a great time to really focus on yourself and your health. How can you come back better and stronger and feeling vibrant and not having to come back and, then diet because you put on the water weight or whatever the case may be. So, sometimes I think reframing can help us. I also like, if you can stop at a little grocery store and pick up even the bags of the pre-cut vegetables, those are really nice. Sometimes
They have
they satisfy a
yogurts.
need for crunch. Yeah, yeah, the yogurts, little things, and they're, people, when you get into cost and whatnot, you can buy a bag of chips or you can buy a bag of vegetables. They're about the same price, but which one's going to leave you really satisfied, right? So. Yeah. The other thing to mention too is, alcohol and caffeine. Got a lot of sports drinks that are popular or energy drinks. Alcohol and caffeine actually draw water from the cell, right? So they can lead to dehydration. So it's important to limit those things, but water, drink freely. Pretty water. If you're a guy, ruggedly handsome water. Yep. Well,
Yeah, and
fantastic.
I think a lot of patients also will think, because of dehydration in summer, that they should be drinking instead things like Gatorade. I always tell patients Gatorade is not as healthy as you think. If you're a diabetic, don't drink Gatorade. Choose sugar-free if you have to. But for the most part, we don't need electrolytes replenished unless you're playing football or, you're like really active all the time. But for the most part, water itself does have enough for us. For most folks, obviously there are folks and there are scenarios that if you're having nausea, vomit, and things like that, your electrolytes can be depleted. But for the most part, normal water can do us really good.
Yep, not distilled. Yep. Get your normal, clean drinking water. Absolutely. Your body knows what to do with that. Your body doesn't know what to do with all of some of the other additives and whatnot. Or to your point, the sugar content. One of my favorite things I used to see all the time, I love, Jasmine says ice packs are always great to have on the go. They really are. Keeps your food fresh. Feels good on the back of your neck if you're really hot. But a lot of times we go and we'd see, folks with diabetes with orange juice in their freezer. Yeah, got to have it on hand for if your blood sugar drops low. And of course, my thought is always, if you have diabetes, juice is like poison for you because there's too much of it. It's not that juice itself is bad, but when you think about, if you look at like just a glass of orange juice, if you wanted to make a glass of orange juice, it'd take you 5 or 6 oranges to squeeze and make a glass of orange juice. You can't eat that many oranges, but you can drink them, right? So you're getting 5 or 6, oranges worth of sugar all at one. That's what's the danger with juice. And I would always tell folks, if your sugar drops low, treat it. You treat it with glucose tabs. Shoot, take a tablespoon of sugar. Right? Nobody's going to purposely go into the sugar bowl and eat a tablespoon of sugar. It's not appealing. But juice is really appealing when you have diabetes, or a soda pop or a candy bar that you're keeping for when you're sugar. Let's not kid ourselves. You're not keeping that because, to treat yourself like a medication. It's because it's yummy, right? So anyway, that would be my best tip, is to skip the juices. They're not healthy. They're not good for our kids either. good clean water, fruits and vegetables. The whole fruit is so much more satisfying. It'll leave you feeling satisfied, and it won't cause your sugar to spike like juice will.
By
Yeah.
all means, if you absolutely can't, some people can't drink water. People have different reasons. Try to, spruce it up with, like Jasmine said, but sometimes even like a splash, when I mean a splash, like a splash of apple juice, like just the
Yeah, it's
littlest
just
bit,
enough to flavor. Yep.
just the littlest bit. Or, sometimes those crystal lights, those sugar-free ones can be helpful, just a little bits where it's just having that moderation to do that.
Well, and it's progress, not perfection, right?
Yep.
I don't know anybody yet who can walk across the swimming pool. There was one guy who did it. That was a long time ago, right? Who could walk on water, but yeah, you don't have to be perfect, right? But it's how can we make better choices today than we did yesterday? Over time, as we continue to work on making better choices, we eventually end up in a better place. And it seems effortless if we don't put too much pressure on ourselves. And when we fall off the wagon, give ourselves a little bit of grace, and get back on there to take care of yourself. We only get one body, and it makes life really hard when that body isn't with you anymore, especially if it's been, hasn't been taken well care of. It takes effort to take care of ourselves. I think that's worth mentioning too. We talk a lot about self-care, and it's really important. There's so much that people can do to avoid some of these really catastrophic kind of medical conditions, like dialysis, sometimes even cancer. But it does take some energy to take care of yourself. Little by little, we can all make our lives a little bit better tomorrow than they are today. It's just a matter of figuring out what are we going to do differently. Does anybody else have any other tips, any other things that they wanted to add? Okay. Well, from the SCM nursing crew, have a wonderful summer, everybody. Take care of yourselves and live well. Bye, everybody.